I'm Dr. Derek Lee. This is a sample of one of my wellness training videos, the ones I typically send out once a month to my patients and those who are interested in just getting a little bit more information in detail. Today, we're going to focus a little bit more on vitamin D. And it's timely because over the last couple of years, there's been quite a bit more research and information in the media regarding vitamin D supplementation and dosage and what it actually does. So today, we're going to be a little bit more specific on what the research indicates, and the dosing is something I'll also recommend as well. Now, if you're feeling a little bit unmotivated, a little bit down and blue, perhaps sad with seasonal affective disorder, fatigue, low in energy, if you have muscle and bone pain, including any or all of the following: hip, knee, back pain, even pain on the balls of the foot, you might be vitamin D deficient as well. One symptom I like to describe to my patients is that sometimes when you wake up in the morning, or quite often, you get out of bed, you're really quite stiff, and you do an impersonation of a robot as you walk down a hallway. All that stiffness in the lower back and hips can be a result of vitamin D deficiency as well. Now, we should try to increase vitamin D in our bodies, but why? Well, there's a ton of research supporting the effects of vitamin D and its positive effects on mood and general body pain, including fibromyalgia. But how do we get vitamin D naturally? We can get it from food, we can get it from sun, or we can supplement. We're just going to focus on those various sources as we go through the video here. Natural food sources of vitamin D. Typically, it's fatty fish such as salmon that are the best natural sources of vitamin D. And if we look on the column on the left, we can see that fish liver oil such as cod liver oil, especially in terms of tablespoon quantities, 15 mils, produces about 1,360 international units of vitamin D a day. Other species include herring, catfish, salmon, mackerel, sardines, tuna, and eel. So with the herring, you need to eat about 3 ounces daily in order to generate 1,383 international units. Surprisingly, a whole egg also has vitamin D, but it's very small in terms of quantity. We can also generate vitamin D from the sun, but it's hard to do, especially for Canadians and those who live in northern states. Why is it difficult? Because the sun variables have to be very specific for us to generate vitamin D. For instance, the ultraviolet rating has to be greater than 3 for us to generate vitamin D. If it's less, we don't generate anything. Our shadow has to be shorter than we are tall. For instance, we could actually generate 0 vitamin D, but we can get sunburn because of the angulation of the sun has to be correct. So if your shadow is shorter than we are tall, you're not generating any vitamin D, but you can get sunburn. We also require maximum skin exposure in terms of generating vitamin D. So if you're covered up, if you're wearing a long sleeve, a hat, long pants, then you're not generating any vitamin C. You have to have direct sun exposure. So in a nutshell, you have to be in your bikini or your swimming trunks to generate vitamin D. Also, no sunscreen, of course, because it blocks all ultraviolet B, or most of it. Now, typically in about 20 minutes of full skin exposure to ultraviolet B, we generate up to 10,000 international units daily of vitamin D3. Just in comparison, with 1 tablespoon of cod liver oil, we actually ingest about 1,300 IU vitamin D. So you can see in terms of the quantity we can produce on our own, it's quite massive if we have a proper exposure to the sun. Note, if you have darker skin, it takes 6 times longer to generate vitamin D, even with full sun exposure. So if you're darker skin, most likely you need to supplement with vitamin D for sure. And the results, most Canadians and northern residing Americans are vitamin D deficient. More and more MDs are testing for this. It's just a simple blood test, but you can get started today. Just to note, if you have primary hyperparathyroidism, you have to consult your MD first. The most practical and fail-safe method of increasing vitamin D levels in our bodies is to supplement. Unless you, of course, eat a ton of fish, and or get a healthy dose of sunshine on a daily basis. Patients often ask me what my family supplements with in terms of vitamin D dosing, and typically this is my recipe. My wife and I take about 4,000 IU daily. My teenagers and my tall tween, because teens and tweens are basically the height of that we are today, are also the same dosage. My 7-year-old takes about 2,000 IU a day. Now, what's interesting is that with vitamin D, you can actually take a weekly dose as well, because there is research out there indicating that a weekly dose will hold in your system just as a daily dose does. So typically, on every Sunday, I'll line my kids up. We'll give them about 4,000 IU times 7 days, or 20,000 IU once a week, every Sunday, and we give it to them with breakfast in the morning, and it's done for the week. So it's easy to take in. Now, vitamin D comes in a couple different forms. They come in tablet forms, or they come in drop forms. And I like to use the drops because it's generally quite tasteless. So it almost tastes like they're ingesting olive oil, and they have no problem with that. Taking that many tablets, which are typically 1,000 IU a day, is quite a mouthful, and it's much more difficult to get the kids to take. Okay, of course. Just another note, consult with your healthcare practitioner for the dosing that's appropriate for you. This is what I recommend for my family. Now, can vitamin D be toxic? Can we take too much? Yes, but you have to take over 40,000 IU a day for a while before there is a risk. Don't forget, we can manufacture 10,000 IU on our own with sun exposure. Now, I take 4,000 a day, which is minimal, I believe, but you typically only get the health benefits of vitamin D in larger amounts. For instance, with heart cancer risk, you can actually cut that by 50% for breast cancer, prostate, lung, and colon cancer. But once again, the dosage has to be sufficiently high in order to attain that protection. Now, this is an important point. You should take your vitamin D with food, preferably foods with a bit of fat in it, because 60% of the vitamin D won't be absorbed otherwise. Vitamin D is a fat-soluble vitamin, so it needs the fat in your food to be absorbed. Now, how soon before I see improvement? It depends. It can take a few days to 3 months. So don't stop until you give it a long try, because don't forget, if your levels are low to begin with, it's going to take longer to build up in your system. Now, if you would like to receive these wellness training videos every month with notes, just subscribe below. Or you can check out my Facebook business page and just search for Dr. Derek Lee. Hope you enjoyed the sample. Don't forget, just click on this link and sign up for a free subscription, and I'll email you a link with the next video and with the notes included. Talk to you soon.